Welcome back. If you're just joining us, I'm Keith Friedenberg, Chief Operating and Innovation Officer at CHIME, and it's my absolute pleasure to welcome you here today. This virtual innovation summit just wouldn't be possible without the amazing support of our sponsors. So let me just take a moment and thank Avasure, Microsoft, and Nordic. We greatly appreciate your support. Thank you for helping us bring this virtual innovation summit to life. I'm delighted now to introduce our panelists for this next session on responsible, ethical, and caregiver-centric AI adoption in healthcare. Terry Kautz is Vice President and Chief Digital Officer at the Guthrie Clinic. Cheryl Goswami is Chief Information and Digital Officer at the University of Wisconsin Health System. And Jacob Hansen is Chief Product Officer at Avasure. Terry, Cheryl, Jacob, thank you for joining us today, and it's great to see you all. Welcome.
Thanks for having us.
Yeah, okay, everybody's off mute. We can hear everybody. Great to see you all. Thanks again for joining us. Okay, time is short in this particular session, all of our sessions today, so we're just going to jump right in. I mentioned in the last session with Aaron Murray that I'm just back from a Michigan regional roundup of CHIME members, and we talked a lot about AI. We talked a lot about the hype, but also about the potential. So we're going to kick us off with a question about all the noise you hear out there, AI, everything's AI. What are some common misconceptions you're seeing out in the market today? Terry, can we start with you?
Sure. I think one of the things I hear most often is that AI is going to replace, nurses, or they're going to replace the need of clinical care teams. And I think that is certainly not the truth in the matter. I think, primarily what we're looking at is how do we use AI to enhance or to augment. And we've done that in a couple different areas, but I think that fear of how does this impact me is certainly out there. I think another misconception is that, there's this concept that the machine or the computer will be making these independent clinical decisions without any kind of human interface. And, that's not what we're aiming for either. I think, it's really just to have some help augment the data to bring it to the forefront, but not necessarily to do it independently. So I think those are the two things that I hear the most that from a clinical standpoint is, top of mind.
Yeah, thanks, Terry. Certainly hear a lot from other CHIME members out there, this sort of fear-based response in terms of, oh my gosh, it's going to take my job away. But I also hear often the response that, listen, this is about technology augmenting our workflows and augmenting supporting clinicians, et cetera. So absolutely agree with you on that one. Jacob, can we go to you next?
Yeah.
What are you seeing out there? What misconceptions are you seeing about AI out there?
I'd certainly echo what Terry shared. A lot of questions about how AI can really help somebody work on the right things at the right times, not taking the need for them as an individual away. One other thing I would add is it's an anxiety you have to work around. People, both sometimes caregivers and patients, worrying a lot about being recorded all the time. This notion of privacy. As long as the right steps have been taken, in most cases, this is either live video or live audio, and it's not capturing anything, right? You may not have anything other than a computer-generated image that's live streaming, but there's this anxiety or fear that, hey, PHI or my image as a caregiver is being captured and stored somewhere, and that's really not something that should limit the benefits that AI can provide. Totally understand the worry. You see this camera in the room and you wonder what it's there for. But certainly a misconception that we run into, this worry about privacy.
And do you think some of that concern is based on just not really understanding the technology or how we're trying to use it in a clinical care setting? Yeah.
I mean, I would say it's interesting. It highlights the importance of training and education. So much of this is just about communication up front to empower people in the bedside or in the unit environments to help them understand, hey, this is what we're trying to accomplish. This is what it's here for. This is what it doesn't do. Information's power in these cases, especially because we ask so much of clinicians anyway. So then you layer on all sorts of new technologies and you just expect them to intuitively understand what it does and why it's there. I think in this case, information's the big equalizer, and empowering them on what it does and doesn't do.
Yeah, thanks, Jacob. I want to go to my friend Chiro here next. By the way, I worry more about what this thing is listening to all the time. And the only reason I tolerate it is it tends to help me, right? So I open up a browser and, oh, there's that product I was just talking with my wife about. It's right there in the ad. Um, it's a little creepy at times, but I tolerate it because it's helpful to me. And I think, again, understanding or patients having an understanding and education around what we're trying to do with some of these technologies, I think would mitigate some of that fear. Chiro, my friend, thank you for joining us. How about you? What misconceptions are you seeing out there in the market?
In many ways, Keith, you took my thunder away, because I would say
Oh, sorry.
the first misconception that, at least in our journey of awareness of AI, I try to remind people that AI did not get invented over Thanksgiving weekend of 2022. AI has actually been around for more than 40, 50 years, actually in the mid-70s, and we have all been using AI for a long time. And if you go through the journey, even in healthcare, we had rules-based logic or deterministic AI, and everybody thinks AI equals generative AI, large language models, and AI equals open AI. When you start with that and you give examples where people have been using AI in their day-to-day examples, and you held up that phone, if you're talking, Siri's listening, Alexa's listening, everyone's listening and sending you alerts. Well, that's some form of AI back in, for about 15 years now. So when you get past that hurdle, then it becomes a little easier to say, all right, now you've got my attention. Tell me more about what I need to know. But AI is not new. It's been around for a long time.
And transparency is really key, right? And we'll get into that a little bit more as we dive a little bit deeper into this. We could spend an entire virtual summit on Gen AI. That's not our focus today. We have barely enough time to cover the ground that we want to and need to. We want to focus on AI adoption that's really caregiver centric. So my next question for you all is, how can AI be designed and implemented to better support and enhance the caregiver's role?
From my perspective, we have to understand how the models are being trained, and making sure that we are not creating biases that can perpetuate the ethical concerns that are out there. But I think that there are simple things through automating documentation, ambient listening, computer vision. There are things that are done from a tactical kind of level, from a that we add to our clinicians every single day, that can be lifted from that daily burden, and understanding your use case and how you're going to implement that is a big part of our role. But we do have to understand where it's getting its data from, and then how it's being trained, because how my health system provides care is going to be a little bit different than how Chiro's health system provides care, and we need to understand that.
Yeah, I have this philosophy about healthcare organizations. If you've seen one hospital or healthcare organizations, you've seen exactly one, right? Every single one is going to be unique. Chiro, I want to go to you next. So let's just imagine you have an opportunity to sit down with an AI technology developer, and you can talk to them about how they can better support and enhance caregivers in the caregiver role. What advice would you offer to an AI developer?
So the call it the four first principles that we always apply is efficiency is a given. If it's not making simple things simpler, don't even talk about it. So the efficiency, the first E is given. The second one, interestingly, is actually in the title of this presentation, right? Is it ethical? Just because it can be done doesn't mean it should be done. I don't want to use AI to inform somebody that, hey, your loved one got detected positive for a test at 2 o'clock in the morning. No, don't do that. Technology exists for the sake of making things easier, doesn't mean it's always efficient and ethical. The third one is equity. Whether we like it or not, this is a double-edged sword. And if not used appropriately, back to Terry's point here, it will further the digital divide between the organizations, between the large academic medical centers, and where really the heart of America lives in rural areas with small hospitals out there. And of course, also the equity aspect of our population. Some may be privileged and some may be punished by the use of these tools. So we got to be careful of that. And the fourth and probably the most important one from my factor is empathy. Technology should never replace the human being and the human touch that all of us in healthcare signed up to do, is to take care of a patient. And so enable everything in the clinical world, but do not replace empathy with technology. That's
I love that aspect. And I just something that Aaron said in the last session, his keynote really stuck with me, which is caregivers will do just about anything to help the patient, right? And if you can't help them, they'll work around you. And that's how dedicated they are to their craft and delivering great care. Jacob, Absher is in the space. You are a developer of AI solutions or AI solutions. How are you looking at caregivers in thinking in terms of how can you better support them in their roles?
Yeah, I really appreciated the sentiments just shared by Terry and Chiro from the health system perspective, and we think a lot the same way. Two things I would add to it is, on our side, when you're going through the design process, a big part of that is also being ultra clear on how you test. And so for us, that means that we have to be super clear that we are finding ways to test in environments that mimic as closely as possible the users that we're targeting, that we're being super clear on what good looks like before we're iterating in production with a health system. And then the second piece to that puzzle is that when we're designing, that we're ultra focused on feedback loops, iterative feedback loops. We have to have ways for clinical leadership, for users, for our teams to all stay connected and engaged, because every environment is different. That means, right, doesn't matter what kind of AI you're talking about, in most cases, you've got to make sure that it's getting customized and learning in the right way. So the only way that you can do that is if you've established these loops, whether it's in the design of the system or process to match it, to make sure that information about the performance and behavior of that artificial intelligence has a way of being measured and then adapted as you learn.
Yeah. Terry, you mentioned something in your response in the last question about ethical concerns. What are some of the primary ethical concerns you and your organization are worried about when you're integrating AI into virtual care settings?
Yeah, a couple of these. Did you say Terry or Chiro?
Terry, sorry.
Okay,
Terry.
sorry. A couple of these things have already been mentioned already. You know, the privacy concern, and it's not just about the cameras, right? I do believe that there is a responsibility that we have to make sure that we understand the data collection, where it's being stored, how it's being aggregated, whether or not images are stored and those things, and making sure that the patients get the privacy that they deserve. Obviously, we had the same kind of concerns when we implemented our virtual nursing program, not just from a privacy of patients, but also privacy of caregivers. And so they were also concerned that there was this big brother kind of concept that we were auditing them. And so really making sure that we address those privacy and data security concerns. I think also, you know, just transparency on how the AI works and the algorithms that are being implemented to help make the decisions. I think, you know, we have, as leaders, have the responsibility to understand how it was trained, where it was trained, be part of that training, kind of like what Jacob was talking about. You know, we have taken the approach that we're actually training in our ecosystem because, you know, the way our rooms look, the way that our devices that we use are going to be completely different than another health system, because there's many different choices out there. So we have to understand what those algorithms look like and where the data, and then consistently validate. Just because an algorithm works now doesn't mean that there's not something that's changed in our environment, and that we have to have a way to validate that those algorithms are still safe and appropriate for use.
Yeah, thanks, Terry. Chira, I want to go to you next. I want to mention a conversation I was a part of late last week. We were talking about transparency in physician-patient communication. We, of course, now have the tools that allow AI to draft a communication from a physician, right? If you're doing this right, you're being transparent. The physician has to review it and then okay it, right? And then you send the communication. And you see examples where at the bottom of the communication, it might indicate to the patient receiving this that, hey, a part of this communication was drafted using AI. And the question was, as a consumer, how does that make you feel? And I was a little mixed, and we'll go to you on this ethical question here, but I was a little mixed in terms of my response. From one perspective, the transparency is key, right? As a consumer, I want to know that my physician is being transparent about the fact that they're using AI. On the other hand, I was asked, do you trust the communication more or less because AI helped develop? I said less, but I don't know why. My brain had a hard time sort of reconciling that. I don't know why I feel like I would trust it less. I use Gen AI every day in my work, right? So I'm trying to embrace it from a consumer perspective, but it gets back to issues around transparency. Chiro, all right, to you. What are some of the ethical concerns? Probably a lot of them are very similar to Terry's, but are there other concerns specifically at UW Health?
Absolutely. I mean, Terry said it very well. All of us are involved in conversations about the local data validation versus the national assurance labs and things like that. And Terry's patient base is very different than mine. So what works in New Jersey doesn't work in Wisconsin,
Right.
so to speak. And it's very important to know that. I would also go back to the transparency. We had a lot of conversation internally, and all of you know me well where I stand on transparency. In that case, knowing that what Keith thinks, it's only for Keith, and Jacob may have a very different interpretation as you laid that out. We actually did not put that footnote, and our rationale for that was the human is accountable and responsible for the final acknowledgement of the message. And our concern was the day we start doing that, not today, but 5 years from now, when it works 99.9% of the time, the human will absolve himself or herself from the responsibility and basically blame the technology when it doesn't work. So I don't know what we're going to do 5 years from now, but we took that hard step of using the rationale to do that and further not confusing the patient in the example that you shared in your own words. Now, for ambient listening, 100% of the times we will ask for consent before we start the interaction with the patient. So it's a little bit, actually, Keith, going back to misconceptions, it really comes back to the consumer base does not have a common understanding of this technology. And healthcare is an industry where your consumer is coming to you when they're already stressed. Yeah. Let's not stress them further. Let's take care of them. That was our approach in going through it. Our last part of ethics actually comes back to our vendor partners, right? Data is data, technology is technology. We are holding the bar high for our vendor partners in being transparent to us, because once it's in the cloud, I cannot tell you what to do with my data. You can start using it and coming back and incorporate AI in your process. So we are raising this question right now for some of our RFPs and stuff to say, how do you plan to use the data? State us your principles of acceptance, your principles of endorsing this technology. And that's the way we're saying it's a community that's going to hold up to the high bar, not the low bar that breaks the rules out here. That's that to Terry's comments.
Yeah, really well said. Jacob, I want to go to you. I think that's a perfect setup. So how does Avasure manage these concerns, and how do you work with organizations like Chiro's and Terry's in terms of understanding their ethical issues, but also being reactive and proactive and responsive to them?
Yeah, well, first I'd say, Chiro, you're not alone. I would say in just about every RFP we see now, there are elements of how, what forms of AI you use, how you measure accuracy, what data do you capture, where is it stored, all of those types of things. And privacy and bias are really sort of the top of mind ones that come out, especially under the collective AI umbrella. But the more specific you get about the type of AI you're deploying, then the more targeted you can be around ethical concerns. So for us, our focus on AI tends to sit more in the computer vision and ambient listening side. And when you think about those two, then all of a sudden safety becomes an ethical concern. And I think Terry actually mentioned this, that people are able to trust. The whole purpose of AI in those two use cases, in many ways, tie to human beings that are trusting either augmented alerts or the ability to take care of more people, or just the technology in general. People have to trust that it does what we say it will do. And that means that kind of comes back to this notion of staying aligned with our partner customers, health systems, to make sure that we're bringing something to the table that's been thoroughly tested, that we have clarity on how we will stay connected. So, you know, the safety of caregivers and the way that they support patients has to be at the center of every single thing a health tech vendor does, or we're not living up to the standard that our customers need.
Yeah, really well said. Jacob, for the next question, I want to stay with you here for a moment. I want to talk about use cases or examples where you've witnessed positive, where the technology has positively impacted caregivers, whether it's, making the workflows more efficient or improving patient engagement or interactions. I've read some of your use cases, Avissure's use cases. Would you be willing to share an example where you've got a really great example here where you have positively impacted caregivers?
Yeah, our I would say our primary focus when we started down this path was really aimed heavily on the safety side of things. So falls and elopement in particular. So that's a big case where we've put our focus, where we're empowering virtual safety attendants and observers to really stay keenly connected to patients, to catch things above and beyond just what they're watching for, because the augmentation that AI provides can put them in a position to succeed. And all of that obviously requires clarity around the why. Hey, what benefit do we expect this to create for you, the caregiver? And then with that clarity, an ability to evaluate how well it's doing that. So there's really the two lenses there, especially whether it's falls or elopement or self-harm, that in all those cases we are creating positive outcomes for the patient, but also that we're facilitating better outcomes for the caregiver as well. Those are some of the ones that we started with, and that we're excited about the benefits that we've seen.
Yeah, thanks very much, Jacob. Cheryl, can we go to you next in terms of any technologies or tools you've adopted that have demonstrably improved caregiver roles or workflows or patient interactions?
So some of them are in the works. I wouldn't say demonstrably, but we're on the journey from good to great, if you may, on that. So again, 15 months ago, we were one of the first in the country to do these in-basket message response generation. At last count, we have over 125 members of care teams, not just physicians, but also nurses. We forget about the largest workforce, it's the nurses. And Sherry's smiling because I know she's one of them.
We have one right here.
And so we took the approach of working with them and again, reducing the time that they don't have to start with, spending all of those. We are in some early test cases of note summation at shift change for inpatient nursing. That's a use case we're working through. Obviously, ambient across the board. I think many health systems are already on that journey. We're there. I know this part is focused on clinical, but I would be remiss if we don't bring out that there's tons of opportunities for non-clinical utilization of AI tools, which actually still steals from the 168 hours we all have every week, like contracts management, PowerPoint generation. These are things that it's the tax we pay, on nights and weekends working on this. And so by generating some of that work through AI, we're giving time back to people that they can then focus on true clinical care.
Yeah, I know we talk a lot about pajama time for physicians and clinicians, but how many of us here also have pajama time? All of us is my guess. So Terry, let's go to you. You are a nurse by background and training, and so some of this is probably really near and dear to you in terms of some of the things you're doing at the Guthrie Clinic to really help the lives of our caregivers and clinicians. Can you talk about an implementation or maybe a pilot program that you're really bullish about, that you're seeing some real positive improvements?
Yeah, so we have done a lot of work with nursing. The pandemic hit us hard towards the end of the pandemic, and we had an exodus. We paid a ton of money to travelers. We had quality go down, and we had issues with unexperienced nurses taking critical care patients. And so we put a large emphasis around how do we augment their care to increase all, or to affect all of these. And we have done this through virtual nursing platforms, and through some automatic documentation, through some escalation algorithms in this platform that helps us have virtual nurses see an escalated need for care, help a nurse that is not necessarily experienced in care, particularly if they were trained during COVID time, because they had a different experience than most nurses that come out of nursing school, and just being able to support them. And what we've found is that not only the automatic documentation is helpful, but the ability to have support, to be able to call out. We've been able to decrease our travelers, all of our travelers in our ICUs actually, which was about a $7 million savings, but also just being able to support that care. So it impacts our hospital-acquired infections. It impacts the ability to care for our patients differently. I think that is monumental. It's not just AI, but it's technology enhanced with AI. And also kind of building off of what Chiro said, I would be remiss, because we've gone through a recent cyber event through a hospital that we acquired. Our SOC uses AI, our Security Operations Center, as a primary tool that keeps us safe every day.
Yeah.
And our caregivers safe. And it's unfortunate in the situation that we have in healthcare today that we're being attacked the way we are, but that's the truth of the matter. And so, I think that particular use case not only impacts his patients, but also our caregivers.
Yeah, absolutely. We've got AI augmented cybersecurity tools out there that do automatic endpoint detection and response, and it can do it in milliseconds, right? Faster than a team member in a SOC might be able to recognize it and send an email alert to somebody else saying, hey, we may have an issue here. That's some really cool stuff. I think what terrifies me, and I know this session isn't about cybersecurity, but I'm glad you threw that in there, because it is the tax that we pay, Chiro, right? We're paying a cyber tax, a cybersecurity tax. Every healthcare organization is. What terrifies me in this space is that the really bad actors out there also have their hands on some of these tools as well, right? So it's constantly a game of, you got to one up because they're one upping. It's terrifying. Just time for, I think, a couple more questions. So looking out into the future, I mean, AI didn't start on November of 2022, right? It's not the dawn of AI. It's been around a lot longer than that, but it is accelerating since the dawn of Gen AI. I think we would all agree. Thinking about some of the most promising technologies that you're seeing out there that you're excited about. Maybe you're not working with them today, but you've got your eye on this technology, or you're seeing developments that have you feeling really bullish on something. What are you seeing out there that's got you excited in terms of an opportunity to really improve patient outcomes in virtual care?
I'm happy to jump in first if nobody else wants to. I'll tell you some of the things that we're actively working on that we're really, really excited about. Many of them tie to ambient listening. And right, for us as a health tech vendor that's hybrid, hardware and software, we're always looking for ways to create more benefit for our customers using the technology in the room. And so from an ambient listening standpoint, one that we care a lot about, that we're super excited about, is staff duress. And so the ability to use those large language models that Chiro referenced to monitor any risk of violence to a caregiver in the room, super excited about what that can mean for caregivers. They can trust that there's something listening and paying attention to what's happening in the room, listening for specific things to indicate the likelihood of violence. We're super excited about that. And then on the same side of that, just the benefits that can be created to staff in a variety of ways through things like wake words and digital documentation. we're just really excited about what the power of ambient listening can mean alongside computer vision things that we've already launched. And so we're really looking forward to bringing those to the market.
Thank you, Jacob. Terry, we've got about 60 seconds left, but I want to give you an opportunity to also share your thoughts. What are you excited about? What do you see out in the market that's got you excited about?
So,
Yep,
so
Cheryl, please.
at this point in my career, technology doesn't jazz me. It's the adoption of technology that excites me. And for the first time, I have hope in my lifetime, we will be able to remove the computer between the patient and the provider in an inpatient setting, all the technologies that we talked about.
I love that. I love that vision. Okay, Terry, last thoughts.
I would echo both Jacob and Chiro, but I would add that, I do think that we're at this influx of AI where we can actually provide the right care at the right time with the right data in any care location. And so that really means that you don't have to come to the four walls of the hospital. How do we use this technology to make sure that we're providing the care at the right time? And I do think that we're in that influx with the right processes and adoption that we can get there.
Well, I want to thank all three of you, Terry Couch, Chira Goswami, Jacob Hansen, Avashir, our session sponsors. Thank you for all you're doing every day to improve patient care, to support our caregivers out there. Thank you for that.